Medicare can be confusing. This video will break down the different parts in plain English. What is Medicare? The federal government manages two main health insurance programs, Medicare and Medicaid. As an easy way to remember the difference, Medicare cares for the elderly, and Medicaid aids individuals who have specific financial hardships. Medicare is comprised of four parts, A, B, D, and C. Parts A and B generally cover 80% of hospital stays and outpatient health care. For Part D, think D for drugs. Medicare Part D is the prescription component to Medicare. More recently, in 2003, Medicare Advantage came out as Part C, and we'll dive more into this in a bit. When do I enroll in Part A? Our usual suggestion is to pick up Medicare Part A at age 65. You are eligible to start Medicare on the first of the month prior to your birthday. For 97% of the U.S., Part A is zero cost. Part A will also coordinate with employer coverage even if you work past age 65. Since Part A is usually $0 and helps cover hospital costs, most of the time it makes sense to turn it on right away. When do I enroll in Part B and D? Our suggestion is to pick up Medicare Part B and D either at age 65 or when you lose employer-based coverage. Medicare Part B is $174.70 per month for most people, and Part D averages about $33 per month. If you have employer-based coverage that costs more than the Part B premium, compare your employer against Medicare. Otherwise, delay Parts B and D until retirement. It is common to start the Medicare enrollment process 3 months before your retirement date. One caveat: the choice to delay Medicare Parts B and D is only advisable if you have access to employer-based creditable coverage. This does not include COBRA. A plan is creditable if it meets minimum standards to copays, drug benefits, network, and out-of-pocket limits. To avoid any Part B and D penalties, you should enroll in Medicare before retirement, but no later than 63 days after losing a creditable plan. Let's fill in the gaps of Medicare. If Medicare covers 80% of hospital and physician bills, the question is, how should you fill in the gaps? Having to pay 20% of a $100 medical bill, or $20, might not sound too bad. However, paying $100,000 of a $500,000 hospital stay could wreck a retirement account. To fill in the gaps, the question we ask is, would you rather pay more upfront for peace of mind, or potentially save some money each month, but pay more later based on your actual usage? This question is a bit more philosophical than we can answer here. Option 1. Medicare Supplement. Traditionally, going back to the founding of Medicare in the 60s, individuals would sign up for Medicare Parts A, B, and D, and then fill in the gaps with a supplement plan, sometimes referred to as Medigap. Adding the supplement premium to the sum of Medicare Parts A, B, and D results in an average monthly cost of $300. A benefit of supplement is the network. 98% of providers participate with Medicare. If your doctor works with Medicare, they have to take your supplement. If someone travels extensively or has a second home in another state, supplement plans tend to ease the burden of needing multiple doctors in multiple states. Additionally, Medicare supplement plans fill in most of the nooks and crannies of Medicare Parts A and B. The result is very little out-of-pocket medical costs, even for the most catastrophic health conditions. Option 2. Medicare Advantage. Starting in 1997 and finalized in 2003, Congress established Medicare Advantage, or Medicare Part C. What was evident at the turn of the century was that through 2036, every day over 10,000 people would turn 65. With traditional Medicare alone, the government feared that covering 80% of all major medical bills for this aging population could cripple the Medicare Trust Fund, leaving seniors vulnerable when they needed help the most. Medicare Part C, often referred to as Medicare Advantage, became a novel solution. The government and insurance companies came to an agreement. For each individual who chooses a Part C plan, the government indirectly pays insurers close to $1,000 per month. Consequently, insurers assume the responsibility for covering all medical expenses. The benefit to these plans is they are often cheaper per month and have additional benefits like dental and vision due to the funding they get behind the scenes. However, the disadvantage is that once control shifts from the government to insurance companies, plans often come with deductibles, copays, narrower networks, and increased out-of-pocket expenses. This mirrors the type of coverage provided by employers. So, while these plans are often cheaper per month, and with more ancillary benefits, you pay more when you seek medical care. Let's review. In most cases, you should start Medicare Part A at age 65. Start Parts B and D at 65, or when you lose creditable coverage. When you turn on Part B, consider whether you want to fill in the 20% gap in traditional Medicare with a supplement, or you would prefer to buy a Medicare Advantage plan. In both cases, you would still contribute whatever premiums you would have for Part A and Part B, so don't forget to turn those on. There isn't one option that best fits everyone. Nationally, people are split about 50-50 between choosing a Medicare supplement or Medicare Advantage plan. Whatever you choose, ensure you collaborate with your local community-based insurance broker. This video is general in nature. A licensed and certified broker is the only individual that can give you advice. They assess your unique needs and compare them against the options available in your region. We hope this helps to give you a foundation of the different parts of Medicare and how you can round out what Medicare doesn't cover using other insurance options.